The last 2 years have seen a massive amount of activity and new initiatives, both inside and outside the Ontario Nurses Association. While continuing to fight for the best working conditions for nurses, ONA has involved more members in the defence of publicly funded and delivered healthcare in the province in order to deliver quality patient care. Unions have been under threat. Healthcare has been under threat. ONA met these challenges head-on, as befits the largest, most powerful nurses' union in Canada. Coming out of the 2012 Biennial Convention with a renewed mandate to engage more members in union activism, we carried forward with our Value the Invaluable advertising campaign. It raised the profile of nurses, winning an incredible response from the public and garnered praise from members who expressed pride in their profession and their union.
Be there when nurse Sophie Chan battles flu, fractures, and splintered spirits on the grandest stage of all, the Super Shift.
In locals across the province, ONA members have campaigned against cuts to RN staffing. The registered nurses of the Scarborough Hospital organised several events against funding cuts and worked with other unions to demonstrate at offices of 4 members of provincial parliament. In Belleville, Kingston, Ottawa, Welland, Toronto and Niagara, ONA members joined in Ontario Health Coalition events to defend public health care. In his infamous white papers, then Ontario PC leader Tim Hudak attacked Medicare and threatened the viability of ONA and all unions. These threats, and others from the federal government, dominated discussions and action plans at the March 2013 ONA Provincial Coordinators meeting. With Tim Hudak intending to eliminate the vital RAND formula, ONA produced an animated video explaining how the RAND formula works and how its loss would cripple all unions. In June 2013, ONA hosted the convention of the Canadian Federation of Nurses Unions. In May of 2014, a contingent of ONA delegates joined CFNU and made their voices heard at the convention of the Canadian Labour Congress. ONA has shown solidarity with the struggles of other unions, participating in rallies for legal aid workers, personal support workers, and striking municipal workers. Across Ontario, ONA, in a coalition of unions, organised a series of town hall meetings called All Together Now, about the need to close the income gap for all workers. The imperative of accessibility to quality health care for everyone was a common concern.
Thank you very much.
The Ontario Nurses Association was a proud supporter of the 2014 World Pride Parade in Toronto. 175 ONA members, staff and friends marched together in the parade. Inadequate funding for hospitals has put unrelenting pressure on collective bargaining for many years, and it was particularly intense in this period. ONA's Central Hospital Negotiating Team won some important gains for members while pushing back against salary and benefit takeaways from the Ontario Hospital Association. The IACs, or Independent Assessment Committees, have proven to be one important tool for successfully combating understaffing at several hospitals and a community care access centre. ONA activists have shared their IAC success stories at provincial coordinators meetings. Backed by solid research, ONA leaders continue to make presentations and meet with senior government officials and bureaucrats to make the case for increased RN staffing. ONA's relationship with its 14,000 student affiliate members blossomed in this period. Nursing students are passionate about their relationship with ONA and are participating in ONA's campaigns. ONA's representatives are present at all the major meetings of the Canadian Nursing Students Association.
More nurses, better care.
In February 2014, ONA launched a new media campaign called More Nurses.
So why is Ontario cutting registered nurses and putting patients at risk?
The first phase of the More Nurses campaign generated much attention from the public and ONA members with a television ad, online promotion and signage. In addition, we did an ad blitz of the Toronto Queen's Park subway station next to the legislature to make sure Ontario politicians heard ONA's message. Nursing Week 2014 was also organized around More Nurses theme. Nursing cuts have affected community health centres and their labour relations. Nurses and others have demonstrated at centres in Brantford and Guelph. Community care access centres also are under threat. ONA members and allied workers are organising to take action. The union has run a targeted radio ad campaign to educate the public, explaining what CCACs can do for patients in the community.
Our daughter Sophie has muscular dystrophy. She's everything to us, and we need help caring for her at home. Our CCAC care coordinator takes a lot off our shoulders. She arranges the services that keep Sophie safe and comfortable, and she makes changes when they're needed. It means a lot to have someone on our side.
Community Care Access Center care coordinators are registered nurses and health professionals who help families get safe care at home. A message from the Ontario Nurses Association.
At the newly merged St. Joseph's Healthcare in London, RNs chose ONA to represent them, bringing more members into the union. Once the Ontario election was called for June of 2014, the possibility of a Tim Hudak government loomed. ONA stepped up its activity. Phase 2 of the More Nurses campaign rolled out with radio ads, a special website, direct mail campaigns, postcards. ONA members volunteered to make phone calls to their colleagues, distribute materials, and speak out about the urgent issues facing nurses in this election campaign. Member engagement and on-the-ground activity was significant. Buttons and literature were quickly distributed to awaken voters to the PC party's policies. Nurses wearing the More Nurses, No Hudak buttons got very favourable reactions from the public. On election night, Tim Hudak was soundly defeated. Kathleen Wynne was returned as Premier of the province with a majority government. The news that a registered nurse in Texas had contracted Ebola virus spurred ONA's efforts to fight for proper protective equipment, training, drilling, and testing for Ontario nurses. SARS taught ONA that we would have to advocate for ourselves because no one else would be held accountable if frontline workers became ill. ONA's efforts, involving health and safety experts, frontline members, and helped by our discussions with CFNU and National Nurses United in the US, enabled us to win protection for Ontario nurses that is foremost in North America. During this period, especially in 2014, ONA engaged its members more than ever before. As this biennial launches us into the future, we will build on that outreach as we face challenges with heads held high, moving forward to advocate for quality patient care and positive workplaces for our members. ONA members are more empowered than ever, and their passion for providing quality patient care will stand us in good stead in the years to come as we work together, proud to be ONA members, proud to be healthcare providers, and more powerful together.